give me just a second and make sure that it's going.
Okay.
Okay, I just got a notice that it is being live streamed. Looks like we are live, and I have still 6:59, so we can wait another minute or so if you want.
Okay.
Melanie, both Judge Robertson and Judge Smith both said that they have sent that to you.
Okay, well, I must have missed it. Thank you for confirming that. And I'm showing we have quorum so far. Amy.
Okay, we are good on a quorum.
Mhm.
Okay, is there anyone who has not identified that you need to record for attendance?
Jim Wesley's attending.
Thank you, Mr. Wesley. How are you, Jim?
Doing fine, thank you.
I see at least one person has joined with, it just says iPad.
Oh, that's me, Pam Bills.
Okay, thank you, Pam.
Marlene Richardson.
Hello, Dr. Richardson.
Hello.
Dr.
Okay,
Miles.
I just logged on, so.
Okay, I see you, Judge Cowan. And Dr. Miles, I see you. I think we should be good. Everyone else is showing up, either their name or their photo. So I think we're good. And I have 7:01. Judge Kelly, would you like to begin?
We can. We'll go ahead and call this meeting to order. What I'd like to do in honor and memory of our good friend and colleague, Dr. Hossein Falazadeh, who gave his life to the medical community and to the betterment of Pulaski County and our region, and was very passionate about the things that he did for this area. I'd just like to take a moment to recognize him in silence, if we could, please. And then I've asked after that if Judge Phelps would open us in a word of prayer. So let's all take a moment of silence for Dr. Falazadeh. Thank you. Judge Phelps, would you please open us?
All righty, if everybody would, just please bow with me. Dear most kind, gracious Heavenly Father, Lord, we come to you with praise and thanks for this day that you've given us, dear Lord. Dear Lord, we thank you for the blessings and the love that you always show us, dear Lord. Lord, I just ask you to be with us in our meeting here this evening, that whatever decisions are made, that it will be pleasing to you and in your will. Lord, lift up the family of Dr. Falazadeh, dear Lord. We just thank you and praise you for his life and the time that we've had with him here. And thank you, Lord, for his dedication and devotion to public health and everything that he's done. Lord, just ask you to be with his family, give them comfort during this time of loss, dear Lord. And we all mourn together, dear Lord, at the loss of Dr. Falazadeh. Thank you for, Lord, for the time that we've had with him. Lord, just ask you bless everyone on this call, bless all the leaders in our communities, give them wisdom and strength during this challenging time. Dear Lord, I know it's just a different world, dear Lord, and just ask you to be with all the leaders and all their communities, dear Lord, and ask you to be with all the health department staff, dear Lord. They're on the front lines of this pandemic, and just be with them and give them wisdom and strength and safety, and thank you and praise you for all that they do. Lord, just again be with us in our meeting. We thank you for your son Jesus and your forgiveness of our sin and your plan of salvation for us all. All these things we pray in Jesus' name. Amen.
Amen. Thank you, Judge. First item on the agenda is the approval of our minutes from our previous meeting. You've all received a copy of those. Would there be any additions or deletions to those minutes? Or if not, we would entertain a motion to approve those as presented.
Make a motion.
I second.
Motion by Jim Wesley, second by that Dr. Miles.
Yes, sir.
Have any further discussion? All in favor?
Aye.
And do we have any opposed? That motion carries. In old business, I want to ask if there's anything the administration failed to adequately follow up on from the previous meeting. If nothing, then we'll move on to the election of our officers. And I know Amy has reached out to our current officers, and I think, Amy, that you didn't have any that weren't willing to serve again. However,
That is so correct.
Dr. Flazade will need to be replaced as an at-large member. So we have our current members willing to serve, but we would need to have a motion or a recommendation, I guess, nomination for somebody to serve as an at-large member to replace Dr. Flazade.
That would serve on the executive committee, Judge Kelly. So we're asking for a member of the district board that would be willing to serve on the executive committee, who looks at the budget ahead of time. It only amounts to a couple of extra meetings a year, the budget review. And then if there's any kind of, like this year, it was a couple of things to make the director nomination and replacement decision. So that's what it would amount to. So it does not necessarily have to be a physician, but to keep the balance of things, that's usually the way that we go. If we lose one position, we usually replace with another or a medical personnel.
Okay, so if anybody would like to nominate somebody, now would be your opportunity.
Who are the physicians currently on the board?
Currently, it's Dr. Miles. Let's see, Dr. Phillips.
I'm a doctor of nursing. I'm a nurse practitioner. But that's okay.
Well, don't sell yourself short.
Actually, Dr. Phillips is their vice chair. So our at-large members and the people on the executive committee includes the chair, the vice chair, the past chair, which is Judge Phelps. And then our at-large members were Dr. Flazade and are currently Dr. Miles and Judge Robertson and Russell. So we have one opening on the at-large group.
It does not have to be a doctor though, right?
It does not, no.
Wonder if my cousin would like to be on there.
Hey, I've just got too many things going. We're building a new justice center and I'm on that board over here at the PDB, but I appreciate the recommendation there, cousin.
Dr. Richardson, is it something you would have time for? I know you served on the executive director search committee. It would just be the budget review, the majority of the obligations. That would be one meeting a year extra unless something unforeseen happens.
Does it matter that I can barely balance a checkbook?
I don't want to put anything on you that you're not comfortable with. You can certainly decline.
Excuse me.
My wife balances mine, and Amy and them make it pretty clear. I was a doctor, not a businessman, so family reminds me.
That's me. I do teeth. I can count teeth. I'll be willing to serve. I'll help you out.
Okay, thank you, Dr. Richardson.
I'll make that motion then.
Second.
So the motion would be for that slate of officers to continue on and for Dr. Richardson to replace Dr. Flazade
Correct.
as the at-large member. Okay.
Somebody else should probably second that besides me.
Who made the motion?
Jay.
I'll second it.
Dr. Miles seconds. Okay. Any further discussion then? All in favor?
Aye.
Uh,
Are there any opposed? That motion carries. Then we'll move on into our resource stewardship. We've got our audit report. I guess, Amy, will you do that?
I will. I think our auditor is on here tonight. I'm not seeing him at the moment, but I saw him earlier. Where
Yes,
are you?
Brad
There you
Hayes.
are,
with-
Brad. Hi, Brad.
Is it okay if I screen share for just a few minutes?
It is. Brian, you may have to give him permission. I'm not certain. Our IT technology guy. Do you have that ability, Brad? Okay,
Is it
it's
up?
working. Yes, it's
Okay.
working.
Great. Well, Amy, thanks. I appreciate the opportunity to speak to everybody this evening. I'd like to thank Ron and his staff also for the hard work that they put in trying to get ready for the audit. We could not do what we need to do without their help. So, but I'll just go ahead and start with our independent auditors report. There's actually 3 reports in here, but I'll talk about the other 2 here in a few minutes. But in the auditor's report, we talk about management's responsibility for the financial statements, and then the auditor's responsibility. And then at the bottom here, we actually have to issue an adverse opinion on generally accepted accounting principles. And that's because you're required to report under a regulatory basis by the Department of Public Health in Frankfurt. But right here is where we issue an unmodified opinion on your regulatory basis of accounting, or a clean opinion, if you will. The other matters paragraph talk about different supplementary information, and then the other reporting required by government auditing standards. That's one of the other reports I'll talk about here in just a few minutes. So here is your statement of assets, liabilities, and fund balance as of June 30th. So you can see there that you had about 10.3, almost $10.4 million in cash. You had another $2 million or so in certificates of deposit, for a total of about $12.4 million in cash and CDs at the end of your fiscal year, compared to about $100,000 in current liabilities, payroll holdings, and so forth. And then you've got your fund balance. You had unrestricted fund balance of about $6.8 million. You'd started reserving some of your fund balance for different things, including future retirement contributions. And then you have various programs that have state, federal, and fee restrictions placed on them. So the next is your statement of revenues, expenditures, and changes in fund balance. I'm not going to go line by line through this, but overall, your revenues came in over budget by about $1.1 million. And then your expenditures came in under budget by about $700,000. So overall, your net change in cash for the year is approximately $2.7 million. Following that are your notes to the financial statements. Again, I'm not going to go through every single one of these, but note 1 basically just has a summary of your significant accounting policies. Note 2 talks about your cash and investments. I will point out that at June 30th, you're required to have all of your cash and CDs fully collateralized. They were actually under collateralized at June 30th. I believe Ron is either working on correcting this or has already corrected that at this point. So note 3 has a detail of your fund balance. And again, the different programs restrict, state, federal fees if you have excess revenues over expenditures. Note 7 talks about your retirement plan and your OPEB plan, or the insurance trust. Again, I'm not going to go into detail about this just because we've been talking about it for several years, but your potential unfunded liability on the pension system was about $53.8 million at June 30th. It's actually measured at 2020 because that's the last financial statements that were available to be issued. And then your OPEB liability would be approximately, or was approximately 9.6 million. Note 9, the related parties, just shows all the tax and district contributions for the year. So following your notes, got some supplementary information. The first one, there's 3 standard pages. The first one is your revenue by program, by funding source. So you've got your state, federal, local, service fees and interest. And then your programs down the left-hand side there. The second page has your direct cost by reporting area or by program. And then the following page is just a schedule of your indirect costs, again, by reporting program. All right, so this is our report on your internal control over financial reporting and on compliance. This is the government auditing standards report that we're required to put in here. And in this, we do not issue an opinion on your internal control, but we are required to report to you if we find either material weakness or significant deficiency. So in this, I'm happy to say that we did not have anything to report to you. And then the final report in here is our report on your compliance for each of your major federal programs. And in here, the bottom of the first page here, again, we do give you an unmodified opinion on your management of your major federal programs, or again, a clean opinion, if you will. Then we've got 2 pages of your schedule of expenditures of federal awards. And this is required reporting by the Office Management and Budget at the federal level. So it's by program. It's actually listed by assistance listing number. But again, it's just a schedule, a required schedule of all your federal funds. Your schedule of findings and question costs. We did not have any findings and we did not have any question costs. We didn't have any prior audit findings and we did not have any audit adjustments. So all in all, it was a good audit as far as that goes. Does anybody have any questions or comments?
I'd like to ask you there, that was a very good presentation, Brad, but are there any areas that you see that you could recommend any improvements in?
We did not have anything to recommend to you. I mean, obviously there can always be something that, you know, that you can improve in, but there wasn't anything from our perspective that jumped out at us, you know, that we're recommending.
Okay, thank you.
Any other questions? We appreciate you doing this for us and the reports you've given. It's always good to get a clean audit.
Yes, sir.
All right. Next, then we'll move on to our financial updates and our director's comments with Ron and Amy.
I will let Ron go first on this if he wants to. You may want to screen share, Ron. I'm not certain. He's going to go over our finances and then I'll give you a few comments on where we are as an agency.
I'll be happy to, Amy. Just hang on just 1 second. Everybody see this?
Yes.
Yes.
Okay, this is going to look a little different. The one that Amy has in the packet you received doesn't have all the page numbers on it and everything. This one's a little cleaner. It's the same exact one, but you'll be missing things like the financial position by the cover page here, the table of contents, things like that. So we're gonna first go to my summary here. This is probably one of the things also missing in your packet, but every page after this you have in your packet. Through October of this year, we had we were showing 11 $11,789,447 in assets, with $88,422 of current liabilities. We're doing very well so far with how much we have in cash and reserves and assets. It's equal to over 6 months of this year's average expenses. Year to date in revenues, we have $4,852,137 and $5,476,983 in year to date expenditures, resulting in $624,846 year to date deficit. I will explain in a second why that's not a big deal. That's a normal occurrence for this time of year. Our annual revenues are normally less than budgeted, mainly due to not receiving a lot of our local tax revenue. So, as many of you know, we don't charge back the amount of tax revenue that all the 10 taxing districts owe us until about December is the first half we charge, and then we normally charge the second half in May. And we normally get those payments by the end of May. So we're obviously, I'll show you right here. Scroll down real quick. We budgeted. We're missing roughly about $3 million, I guess you'd say, in local tax dollars. Or actually a little more than that, about over $3 million in local tax dollars. So that's why it's once again showing behind. We don't receive that every month. So as a result, as of October, we are always usually behind until we start getting our local tax dollars in December. The DPH is 5 quarters behind. It's a note we always give. We always want to tell you this because it's a significant amount. They have been very lagged on their billing of Medicaid match payments to us for quite some time. It's accrued up to $500,000 now. So they could collect that at any time, but we're in very good financial position to cover that at any time they choose to bill us. But we are not allowed to catch that up ourselves. They require us to wait on their billing for that so they can catch up in their system. It's very difficult as I was describing before to predict a reliable financial position right now through October. So as a result, we still plan on ending the year as a budget of 1.5 million surplus as we budgeted. I will tell you that I do project as of now for that to be better than that, actually. Mainly because if you remember what the auditor just said, we ended last year about a $2.7 million surplus. And this year we had budgeted a little more conservatively in the sense that we didn't budget for the COVID that's happening right now. To my calculations, we've almost, if not already, surpassed what we had budgeted in COVID services. And if you remember, for our COVID services, we get dollar for dollar reimbursement. And any time that we get dollar for dollar reimbursement in our clerk staff and we have different people getting pulled over to do different jobs. If we're doing less clinic services where we sometimes lose money and diverting that to COVID services, we're getting dollar for dollar reimbursement instead of losing money as we do at times in some of these clinic services. So there's not much good that comes from COVID except that it does help us a little bit cash wise as a health department until that well dries up. And right now the state has not dried up that well yet. I'll move on really quickly. The summary of statement of revenue and expense. It basically reflects what we just said, showing the $624,000 surplus year to date. You guys have that in your packet. You can see how that breaks down between all the different revenue and expense categories. And then we have 2 charts below and 2 charts following that show a more detailed breakdown. Like I said, I won't go through that. I'll let y'all look at that yourselves and how the different revenues break down. Of course, a lot of that right now is from COVID, as you can imagine. Mostly hands and COVID is where our revenue is coming from right now. And of course, as you can imagine, most of our expenditures are coming from salary and fringe as usual. The balance sheet, we already went through that. I won't go for that. There's a more detailed piece of the balance sheet. I already told you our asset position, which is right here, 11.789 million. And here's a comparison. I did want to go through this really quickly, just in future, you not to be alarmed. As I told you, we're normally in a deficit position. Remember last year we finished with a $2.7 million surplus, and as of October, we're at a $127,000 deficit last year. So that's why I'm telling you there's nothing to worry about through October, because there's quite a bit of funding we haven't received. We've not received the major subsidy payment that or the second half of the subsidy that we'll get in April for the retirement, and we haven't received any of our local tax dollars yet. So that'll be a huge bump in revenue as soon as that comes in. So there's nothing to worry about right there. I would project once again that we will plan to finish over our budgeted $1.5 million surplus. So I think we're tracking very well right now. This is just a snapshot of our current services. They're actually all, I'm not gonna go over these much because all of them are pretty close to where they were last year because we're deep into COVID as we were last year. So when we compared last year to the prior year before, when we were doing this last year in October, there was a dramatic drop in services because we had been doing quite a bit of clinic services and then we switched to COVID. But since we're still in COVID and not doing much clinic services, they're kind of evened out. So it's just 2 bad years of clinic services. So as you can see, there's not much change through October comparing year to year. This is just our fiscal year trending analysis. This stays the same as we update it just once a year. So you guys have that if you want to look at it. Once again, a more in-depth look at our financial analysis. If you want to look at our revenue and expenses and surplus per cost center, that's what you can see in our financial analysis page. It'll break everything down by cost center. And then this is just once again a snapshot. Sean before always liked to look at this. I like to look at this too as a picture of it's not always 100%. It's very hard to estimate earned revenue in the health department because we don't really bill for everything. A lot of it is what we expect to receive as reimbursement from the state, and sometimes that's iffy on depending on if the cash allotments that the state gives us. So this is a very highly estimated number. But I'll just show you the bottom line that right now we're tracking just fine. Earned revenue versus actual revenue, 5.6 million versus 4.8. I expect those to get closer and closer as the months go on, as we receive a lot more of our funding. And once again, this is a more in-depth analysis of how we came up with the earned revenue by cost center. And then once again, we usually don't go over this too much because that we've already showed you the unrestricted reserve won't change through the year. It's already been calculated a few months ago. But as you can see, we had an allowable unrestricted reserve of 2.39 million. We will have to do something with that. And once again, what we will plan to do with that money more than likely is put it all toward retirement, as we have that ugly liability you saw the auditor saw that we have to continue to pay back. So that'll help us with the retirement increases that are looming over the coming years. Here's just a snapshot of the extra allocations the state has given us in addition to what they gave us on budget. So these are the allocation modifications that they've already given us since July 1st. And that's all I have. Are there any questions?
Ron, this is Dr. Miles. I have a question.
Yes,
I know for the hospital, the CORS money, we went through an audit, or we sent them in and they forgave everything and we got to keep that. They didn't take anything back from us. Have we been through that for the health department yet, or is that something you all have to do or not?
We have not. I've not been notified of anything of that. So no. To answer your question, we have not been through anything of that as of yet.
It's my understanding almost everybody's getting whatever they were given. I don't think they pulled it away from anybody yet, but we just had to go through that and we got everything back. So I didn't know if y'all had to do that or not.
No, not yet.
I think Dr. Miles too, because ours passes through the state, that they may audit that and look at that at the state level first and then come down to us if there were any discrepancies. It would be my guess.
Okay.
Ron, this is Jake Staten. I was going to ask you if you might clarify for the public out there that's listening. When you refer to year-to-date numbers are and all. You know, they're gonna have to, you know, they need to know if it's calendar or fiscal year when you refer to those year-to-date figures.
Yeah, so fiscal year to date. So all of the year to date numbers I gave you through October 31st, I apologize. That'll be from July 1st, 2021 through October 31st, 2021. So fiscal year to date, first 4 months of the fiscal year ending June 30, 22.
Yeah. And one other question there is, when do we receive these revenues from our property tax?
You mean from a local level, or when do you guys pay us back at the district level?
No, from the local level.
That varies, but if I recall, I think normally you guys receive your bit. Now, a couple of your revenues come in monthly. A couple of you guys have your, some things like some tangible taxes and some motor taxes come in a little more often, every so often each month. But the big number, the real estate tax, I want to say that normally hits in like December, January, February, sometime in that time frame is when you get your big cut of that. That's normally what I see when I'm looking at the financials, but it does seem to vary a little bit year by year when y'all
All
get
right.
that.
Thank you.
Okay. Thank you, Ron. Were there any other questions about anything that Ron covered? Okay, then from a director's perspective, I just want to reiterate that everything that I see from the budget level does look like it's trending very similar to last year, if not a little bit better even, because as Ron said, with our COVID money, that gives us dollar for dollar reimbursement back for our expenses on our staff. So that actually helps our agency quite a bit. So we are looking at a $1.5 million surplus as budgeted. And as Ron said, it's most likely going to be more than that. There's no guarantees, of course, and there's no, we can't forecast out what the rest of the year is going to hold. But if everything holds true to as it has so far, we should be in good shape to end this fiscal year. And I'm very pleased for that. This last surge of COVID, of course, as I'm saying, it's good for our budget and our finance situation. It has definitely taken a toll on our staff and on the public. Just in general, we've all worn ourselves out with this, and we've all just, there's days where my staff just, I don't know how they are going on. It's almost unbearable. So having said that, the next item on the agenda, if it's okay with you, Judge Kelly, I wanted to bring up to the board and ask on behalf of my staff, if you would consider a Christmas bonus, a one-time annual bonus for them. That's something we have done in the past. And due to our budget and our forecasted situation with our finances for this year, how we expect to end, I would very much like to offer that again to my staff. We've done some calculations, and we have the option of a $500 or a $1,000 increment, or a one-time allotment for them. It would be approximately 135 to 140-ish staff members that would qualify for this. It would have to be full-time staff who are in certain pay status, at the time of the award. Carol can probably give more information on that, or Ron, about who exactly would qualify on that. But a $1,000 bonus for staff at this time of year would be most appreciated. And I would certainly like to ask for your consideration on that. It would basically amount to about a $177,000 cost to the agency. So it would be less than $200,000 at the bottom line. And, as I'm saying, as we're expected to end with, anywhere from a $1.5 to $2 million surplus, I would like to ask for your consideration on that. And that's, of course, at your discretion, and you can debate that and discuss as you will. But I would be remiss if I didn't ask for that on behalf of my staff.
Well, Amy, I agree with you on that. And they've exhausted themselves, not only district-wise, but on our local level as well. And I'm very appreciative of everyone's efforts. And I'd like to make a motion. We go and give y'all the $1,000.
I'll second that motion. We did the same thing at the hospital for the exact same reasons. There's some studies that saying 96% of healthcare workers have anxiety, 43% have depression, 43% have insomnia, 76% are worried about what they're going to be taking home to their families from what they're exposed to. And we did that when they announced that. It wasn't actually the money, but it was just the fact that they were appreciated. We had nurses crying on the floor, and that wasn't a huge amount for them for their salaries, but it was they just being appreciated and understanding that people understand what they're going through. So I'll second that motion.
Yeah, I think it's very, it's just, sometimes it goes unappreciated, Dr. Miles. And I mean, it's relentless. It never lets up on them. I've got family members that are in the medical field, and I just know the exhaustion that it puts on the staff and all. And we just want to recognize them. And I just think it's a good thing.
When you think about some of the other epidemics, the flu epidemic, it's going to be done and over with. HIV, a couple of years, there's no guarantee on COVID that it's not going to go on for years yet. And they just don't seem to get the respite. And about the time they start to look like it's clearing up, it comes back. Again, I would encourage everyone to get vaccinated because that's about the only thing that's going to work on this. These variants we're getting, it's interesting. Almost all of them are coming from Africa. I saw something the other day. They only have a 10% vaccination rate in Africa. And it's not because it's not available. They don't trust the government. They don't trust medicine. And the 30% that aren't vaccinated in the country in the same situation. So, I don't know that we're not going to keep seeing just recurrent episodes of this over the next few years. So again, it's relentless, but I think they at least know they're appreciated with that.
All right, we do have a motion and a second then to award this $1,000 bonus. Do we have any further discussion? If not, then we'll ask all those in favor signify by saying aye. And likewise, if there's any opposed. Okay, that motion carries. Thank you, Amy. Thank you, board. Next, we'll move to our grants report with Carol.
Yes, thank you all. We really appreciate it. And later on, when I give my HR report, you'll see just how important gestures like that is in helping us retain some staff. Sorry about that. When HR took over the grant program as well, we brought Melanie over to assist us in HR and in the grants. And that gave us an HR staff of / grant staff of 3. And we recently lost one of our HR grant people. So we haven't really been pursuing a lot of grants with COVID and everything, but we are happy to announce that we received 3 grants that we applied for. One was a very small grant. It was $1,500 from the Foundation for Healthy Kentucky. And it's very similar to another grant we had received earlier in the fiscal year. And we're using it to promote COVID-19 awareness and vaccination, especially in the counties where vaccination rates aren't very, the uptake hasn't been very good. Another one, we applied for a syringe services grant. We actually applied for 5 of them, one for each of the counties that have syringe services. We were awarded $33,000 for each of those for a total of $165,000. And we have been told that we will be eligible for another grant about that size should the core money come through the state. So we have that one, and we're working with the University of Kentucky on that one, the syringe services grant. And Laura, if she's giving a report, might give you a little bit more information there. And then we received $127,000 for 2 community health workers to help us in the diabetes program. And Jamie may want to elaborate on what she's planning to do there. And that's all I have for my grants.
Okay. Any questions for Carol? Okay, we'll move on to our continuous improvement then. I'll let Amy talk there.
It says on the back of your agenda, there is a place for you to make suggestions. And of course, since we're not in person, you probably may not have even printed your agenda. I'm not certain, but you all should always know that I'm available by phone or text or email. Anytime you have a suggestion or a comment or a concern about anything that's going on in your county or at the district level, I'm more than happy to address anything like that with you all. So just be aware that I'm available to you, and feel free to make suggestions, not just on nights when we're meeting, but anytime throughout the year.
Okay. And then next, I guess, will be Janae, present our employee satisfaction surveys.
Yes, and there is a copy of those in your packet. I just wanted to say that we have had the highest response rate this year that we've had in several years. You can see that at the top. 70% of our employees filled out the satisfaction survey and turned it back in. Overall, the general scores were very high. I was pleased with that. And even though we've had a couple of challenging years, it seems like everybody is still satisfied with the workplace. I'll go on to talk about the board survey. As we begin working on our accreditation efforts, we'll have to develop a new strategic plan. So I was going to incorporate our SWOT analysis for that into the Board of Health survey. So I'll probably send that out mid-January. So kind of watch for that. We'd really appreciate your feedback. And we'll need your help with the SWOT analysis to get our strategic plan rolling.
We're going to be starting basically from square one again with their strategic planning for the health department. So we would really appreciate your all's feedback on that. We're looking for strengths and weaknesses and opportunities and threats that you see in the communities and that you see for our agency as a whole. So Janae will be sending it out, like she said, the middle of January. And if you don't mind, if I just backtrack for a second, I'm so proud of my staff and their response rate on those employee satisfaction surveys. We have struggled for years to get our staff to fill those out and to trust that process. And I've tried to explain to them that I'm not going to be able to fix things or to address things that may be going on unless they tell me what the issues are. So by having a 70+% response rate, I am super energetic and excited that means that the staff trusts me, maybe to hear their concerns and to take that to heart. So we are going to be looking at those over the next few weeks and formulating plans on how we can make this agency even better. I'm just super proud of them. Thank you all.
Good. All right, then Amanda, I guess, has their EPI report.
Actually, she texted me today, Judge, and said that data is not available from the state yet. She had sent a request off and didn't get that back, I guess, due to the COVID response and things that are going on. So she asked to push that part off until March, if that's okay. So I'll just carry that item over on the agenda till March.
Okay, then we'll move on to partner engagement with Tracy.
Syringe exchange programs are going well across the district. We participated this past week, 2 weeks ago, with the city of Somerset doing a needle swap or a cleanup at Rocky Hollow Park, and we're going to continue doing those on a monthly basis there in Somerset. That program seemed to be going well. Laura, if you want to add something, feel free to, please.
Can't get it. Am I muted? Yes, sorry. Yes. I'll talk about the expansion grant that we received. Carol mentioned not all of our syringe service program supplies are always covered, and most are, but some aren't. So we'll be able to cover those. We'll be able to expand HIV testing, and we plan on doing one mobile event each month and just do some stigma reducing media type things to share with the public. And that's some care packages. So often people come in, they don't have anything to eat, or, you know, just personal care items. We'll be able to give those out in our programs as well. So.
Okay. Don't have any questions for the Syringe Exchange program? If not, we'll move on to our COVID-19 update with Sam.
All right, folks, I'll see if I can share this information with you guys.
It's working, Sam.
Is that working? Okay, good deal. All right, good evening, board members. I'm thankful to be a part of this meeting tonight, to see you folks and to hear you folks. And I don't plan on taking up a whole lot of your time, but I do want to begin with a few slides to show our current situation with COVID. So as we begin, and to set the stage, this graph that we're looking at here is our county weekly growth. Where we were as of this past Friday, 12/4, is indicated by the green line. Every county is represented. Compared to where we were from the last board meeting in September, represented by the orange line. Excuse me, I guess it's red on the screen now, represented by the red line. And then the meeting before that in June, represented by the blue line. So you can see there's been some ups and downs. Right now, we are currently, for the most part, in the seemingly the eye of the storm. It's not really good, and it's not as bad as it has been. So we're somewhere in the middle. It's a bit easier to see across the district if we see the district weekly growth chart. The same dates as before are shown in red. And you can see to the far left, the June meeting is what we consider week 67 of response. September meeting was week 77, and then ending this past Friday with week 90. So you can see by the graph, things have changed drastically over the summer with the sharp increases in the cases, peaking at just over 21 cases the end of August. But by the beginning of October, cases began to significantly drop. But now, unfortunately, it seems that we're on an increase again. As of today, we are in week 91 of response to this pandemic, and we are currently at doc activation level 3. As has been mentioned, our epidemiologist was not able to attend tonight. So if there are questions relating to any specific data, I may not be able to answer that, but we will get an answer back to you. This information from this chart is provided by the CDC, showing the number of cases in the last 7 days. And this information, this color chart map, is as of yesterday. If we focus in on Kentucky, just as a point of reference, you can see what's been reported to CDC the last 7 days in Kentucky and our neighboring states. So just as an idea of where we stand according to our neighbors.
Sam, while you're, before you move on, I will say that the spike in cases seems to be looking at some of our northern states. The northern states seem to be having more cases reported now, and that follows right along with flu and everything else seasonal kind of things, because where it's colder weather, people are indoors more and spending more time together, unmasked and unvaccinated and whatever, and that's where the spread is occurring. So you can see that on this map, is that the states to our north are reporting more cases than the states to the south, and that's a matter of time. It will shift as the weather turns, I believe, and the variant happens.
Good point. Thank you. To move on, since March 6, 2020 to December 6, 2021, Kentucky has had a total positive case count of 799,695. Had just over 10.7 million total tested. Unfortunately, with 11,289 deaths and a positivity rate of 9.13 yesterday. I think today I think it's increased slightly to 9.17 that I saw. You can see from this, the current incident rate here for the Kentucky map, that we're a red zone state with only a handful of exceptions. Now, I do want to include our local data, as this map is all belongs to the state, and they process the information that they have the way they do it, however that is. But I do want to include our local data that shows a slight difference from the state map. Our district is completely in the red zone, and that's simply because our data is just more real time. We handle it less than the state has handled it. So anyway, just for FYI, we get calls here locally quite a bit, and I know some of you have, because you've in turn called me. But that's the reason for that. There's just a bit of a delay in that information. And with that, we continue to follow and share those red zone recommendations for our communities. I mean, this information here, I'm not going to dwell on this, because this isn't new to any of us anymore. I mean, this is something that we've had to deal with for some time now. Statistically, the Lake Cumberland district, we have a 4.17 hospitalization rate. That's about 1 in 24 among known cases. We have a 1.71 mortality rate. That's about a 1 in 58 among known cases, as compared to Kentucky. Hospitalization rate, we're really close compared to a 4.18. We are unfortunately higher than the state mortality rate, which is 1.41, and then even nationally, which is 1.6. So we're not as good there. As of yesterday's report, the latest data shows that 78% of Lake Cumberland ICU beds are filled, and 24.32% of ventilator capacity is being utilized. Even those numbers sound high, this is really great improvement from where we were just a few weeks ago. So those numbers, at least at this point, are seemingly manageable. This slide shows our case counts as of yesterday, 12/6. Of course, this information goes out as well in the daily briefing. So this information that you're seeing today is current as of yesterday. I have not been able to update it with today's data. But just total active cases throughout our district, we have, as of yesterday, 591 active cases. We've had a recovery, or those that have been released from quarantine, 41,887. Unfortunately, we've had 739 deaths, for a total case count of 43,217. Now, this final slide provides a little information about the Omicron variant, and very little. There are unfortunately still many unknowns, because this variant is so new. It does appear that the Omicron is more transmissible. However, it's just not really currently known if it will cause more severe illness, or how effective the vaccines and the treatments will be against this strain. That information we'll no doubt will find out within the next few weeks, as this thing will no doubt probably spread. According to the CDC, there are approximately 17 states that have detected at least one case of this new variant. As of yesterday's information, or earlier today's information, it was not being detected in Kentucky, but I think it would seem a bit naive to think that it isn't here. It just hasn't been seen yet, hasn't been detected yet. What we can do with this variant, or the ones to come, as Dr. Miles mentioned, is to be patient with science, to use the tools that we have and those things that we have seen to be effective. Vaccines, masks, tests, and education. As your public health department, and that's what we're doing. We continue to have vaccination clinics at all of our county health departments and our other locations, and several other locations within our district as we have opportunity. Many times we take advantage of our mobile van. We're directing people to testing locations. We push out any updated documentation or guidance as it becomes available to us. We continue to have conversations with community partners on best practices. We continue to help support first responders and still helping a few of those congregate settings with personal protective equipment needs as we can. We plan on moving a non-medical supply surge trailer out into the district to more timely provide those needed supplies. And we have hospitals and clinics continuing to give monoclonal antibody treatments within the district as they're needed. The fact is, we will continue to provide services and to provide support and collaboration, and we will persevere to protect and improve the health of our communities simply because that's what we do. And appreciate all the support that the board has been able to give to each of us. This is a really a new journey for me, but this has been a really good opportunity for me to get involved with this board the way we've all been able to work together. So I appreciate you very much. If there are any questions, I'd be glad to try to answer them.
All right. Well, thank you, Sam.
I've got one real quick question. Was there a recent audit of the numbers in regards to deaths? Seemed like our numbers stayed around 14 for a while, and then we all of a sudden there was a sudden jump in deaths. Was there some sort of audit done of COVID deaths?
Thank you for asking that, Judge Phelps. I thought of that when Sam was talking and it had slipped my mind again, but yes, the state is routinely auditing death certificates. So every couple of months or every few weeks, we get a notification. For instance, it happened today. And if you see the public information brief that I put out just before this meeting started, it says that we've had 10 deaths reported since yesterday. And those are audit deaths. Those are ones the state notifies us about. So those would have happened from October to November timeframe. They go back and look at those. There are a lot of instances where if someone dies at home, we don't necessarily know about that at the health department. We weren't notified of that death, even if it was a COVID positive person or if it was a person who had complications from a previous COVID diagnosis but had recovered. As far as we're concerned, we didn't know that. So the state is auditing all death certificates to look for those and to try to get a true and accurate number of people who have died with COVID as a underlying factor or a cause listed on their death certificate. So that is the possibility that it has happened. We usually get those in clusters, like I said, and sometimes it's 10, 15 at a time because they look at several weeks worth and then report it all at once. So that is possible that that's happened.
Thank you.
You're welcome. Our hospital partners and first responders are very good about sharing information with us generally in real time. But if this happens, like for instance, if a coroner is called to a home situation where someone dies at home or, some other thing, we don't always know that. And then for instance, too, if it's someone who has an underlying condition, the state looks at it and weighs the COVID factor in on would it have happened anyway without COVID? And, we don't want to inflate numbers. So they look at it very judiciously and try to only count the ones that are truly attributable to COVID.
I think one comment are a little higher mortality than the national average. You have to remember in our particular area, we have an older population, we have more diabetics, more obesity than you see with the rest of the nation. And that's on almost anything that you look at on morbidity and mortality. We have a higher rate because of the risk factors. And what the doctors in the hospital are telling me is they're seeing fewer patients being admitted, but the ones that are coming in are sicker. And,
yes.
That's some of the contributing factors for those numbers.
That's absolutely true, Dr. Miles. And, early on in this response in early 2020, we had several long-term care facilities affected at a very high degree of incidence. So that attributed to us, we got behind on that mortality curve early on because it attacked our elders first. And now we are continuing to see that elevation because we are sicker. Our region is just not in as good health condition overall as we would like.
Are there any other questions regarding the COVID-19 update? If not, we'll move on to our human resources report with Carol.
All right. So since we last met, we've had 14 people go off duty. 3 of those were merit. 2 of those were contract. 1 was a full-time contract and 1 was a part-time contract. And then we had 9 Crown employees who left. Those were on duty. And then off duty, we had 10 go off duty. 2 of those were contract, 2 were merit, and 6 were Crown. And we have, I think we have like 3 positions right now that we have an HR assistant, the CHWs, and the another CHW, one for the grant that I was telling you about earlier, and then one for the JEP grant. And we've been advertising for those, and we're just having a hard time filling those positions. So hopefully that will change as things get back to normal or the job market stabilizes.
I'm sure you all are well aware, if you're in the public sector, that the job market is horrible. We are having a horrible time trying to fill positions, trying to advertise and find qualified candidates that are willing to take the salary that we're offering and to come to work for us. So we do have many open positions. I will give you an update on the environmentalist position, because at the last board meeting, you all approved an increase in that starting salary for that position. We had 2 openings, particularly one in Taylor County that we had advertised numerous times and for several years. Couldn't find anybody to stay there. We had hired a couple of people and they stayed a little while and then were gone. We have been able to hire someone for the Taylor County position. I think she just started within the last month, so I'm not certain, long term what that's going to look like. But we do still have an opening in Casey County that we have not been able to fill in environmental, but there is a possibility that we have a candidate for that. So not certain that may be filled also in the next few months, but it is a continuing challenge. It's something that I know you all are well aware of and are experiencing too, but we are struggling to get qualified people in to work.
Well, it's not just us. It's a universal problem right now, I believe, at least a national problem. We're just going to need corrections on all levels, starting with the federal government and all the way down to the state government. And then we've got to get this generation to learn how to want to work and want to get ahead. It's a problem. But anyway, if there's nothing else, Carol, we'll move on to new policies with Janae.
We don't have any new policies or revisions, but we do have one draft policy. Carol, do you or anyone want to kind of tell them about that?
Amy, do you want to talk about it, since it's just something that's kind of a prophylactic?
I will. It was included in your packet, so at the very end, you should see a draft policy for COVID vaccination. This is in response to the vaccine mandate that is come down from the federal level. It is our understanding, based on legal advice, that we do not fall under the CMS vaccine mandate. So that would be the one that requires all healthcare workers to be vaccinated. But we will fall under the OSHA ETS vaccine mandate, which is for any employer with 100+ employees. So that does give an option for anyone who is not vaccinated to receive a medical or religious exemption and then test weekly with that and continue masking. So that is what we're planning. That the draft that is in your packet is the standard template that was provided by OSHA off of their webpage, and we just pulled it off and put our information in. That at this moment has been stayed by a judge, in the Fifth or Sixth Circuit. I think I've lost track of what is going on, but it's my understanding there's supposed to be a ruling on that by the end of next week, is the anticipated timeline. And once that happens, if it's continued to be stayed, then there will be no changes. If it is overruled or turned over or resolved and said that it can go forward, then facilities will need to have their plan in place and that the time will start clicking on that. So we need to have our plan, a draft plan kind of identified and outlined. So we developed that and put that out before you all. I'm not certain, since we're calling it a draft right now, that you all will need to approve necessarily at this moment, but just need to be aware that this may happen. And it may happen before the board meets again in March. So we may have to tentatively go ahead with this and do that before you can actually physically approve it again. But wanted you to be aware that that's potentially coming. Our lawyers and legal advisors have told us that if the stay is lifted and it does go into effect, that we would still have the full amount of time to come into compliance. So even though the deadlines were supposed to happen like December and then January to be fully vaccinated for staff, that we would still have that full time. Since it's been held up in court, that wouldn't be held against us. So we just want to have our ducks in a row and be ready to go with this. I know I attended a webinar last week from CACO, the Association of Counties and things. I know Judge Cowan was on that. I saw her on there. Different ones of you all may have seen that same presentation, but that's basically the information they gave us then, was to be ready depending on what happens and kind of be looking ahead. So that's where we're at with it. So just wanted to make you all aware.
All right. Thank you. I guess that brings us to the end of our scheduled business. So I guess our next thing would be to schedule our next meeting, which we're looking at the first Tuesday in March would be the first. Is that correct?
Yes, I had not looked ahead that far, but yes, the first Tuesday of March would be the March 1st.
And that'd be at 7 o'clock Eastern Standard Time. So
Hang
I would
on.
like to. Yes, Judge Phelps.
Judge Kelly, I've got a question before we depart. Has anybody got any idea how long Dr. Falaza Davis on the board? I've been here 11 years and he been, I know he's here before I got here.
I tried to look back on that and it would require me to go back through every meeting minutes, I think. I tried to just randomly go back and look and I hadn't been able to find time to get that done, Judge, but I will try to. I called the state and asked if they knew, but they don't keep track of the district boards. They just keep track of the locals. So
the point that I'm getting to, I know he's been hung with it for a very long time, and we've got a lot of other board members that are citizen members. And do you think we could develop some corporate sort of recognition program for their time served, whether it's 5 years, 10 years, and so forth and so on? And do we have an award program for our employees for time served?
We do. We do increments. We do 5 years, 10 years. We do service pins for our employees. And then we do Employee of the Month recognition for above and beyond, when they go above and beyond their employment job duties and things. But I'm looking at revamping some of that, Judge. And actually, you're on the same train of thought.
I don't want to throw any more on personnel, but it would be nice if we could recognize, folks that have really hung with the board, while we've got them here. And so if y'all could put some thought into that, whatever you all think. Some of the other board members, y'all chime in, but I think it'd be appropriate if we can find some way to do that.
I think
I'm on
that's
the
a
same
great
page.
idea.
Yeah. And I've talked to some of my staff about that, about revamping some of this and creating some awards for community members who promote public health in their local communities and across the district. So yes, I think we can definitely do something with this for sure.
Okay.
What Judge Phelps is saying is he didn't get his 10-year pin. He's mad. No, that's a great idea, Judge.
They recognize me pretty good for being the chair. If you hang with it long enough, Steve, they'll recognize you too, buddy.
All right. Well, if there's no further business, March 1st, 7 o'clock And 2022 will be our next meeting. And I would entertain a motion to adjourn.
I'll make a motion. We adjourn.
I'll second that.
We have a motion and a second. All in favor?
Push the leave button.
Aye.
Any opposed? Motion carries. Thank you all and have a good night.
Thank you. Merry Christmas.
Thank you all.
Merry Christmas.
Merry Christmas.